Drug and substance abuse has been a big problem amongst young people in Kenya, especially in the coastal counties of Mombasa, Kwale, and Kilifi. It is for this reason that the government, together with some non-governmental organizations, have taken up the initiative of rehabilitating the affected young people back into the society. One such organization is Reach Out Drug Treatment Center based in Mombasa. It has been at the forefront in the fight against drugs and rehabilitation of drug addicts and restoring their lives back to normalcy. However, since the outbreak of the coronavirus, the institution has faced quite a number of challenges in carrying out their mandate of rehabilitating the drug addicts, especially in consideration of the COVID-19 Ministry of Health regulations. This is as explained by one of the directors of the institutions.
Our main mandate is to reach drug users, both at the outreach level, that is the hotspots level, and also at the DSC. Before the COVID pandemic, one of our main mandate is to conduct hotspot outreaches. Hotspot outreaches are activities where we can reach the drug users in large scale, because we are reaching out to them where they're using the drug in the hotspot. But during the pandemic, we had obstacles in performing this noble duty because of the lockdown and the MOH, the Ministry of Health guidelines. We were not allowed. That was a guideline from the County Commissioner's Office. So we were not able for almost 3 to 5 months. We were not able to do that specific activity, that is hotspot-based outreach. So what we did, we had to come up with alternative ways. Like I said, we have quite a number of drop-in centers. So we had to make use of open some more satellite drop-in center in Likoni and in Changamwe Meritin, where we now covered the smallest number of drug users coming to the drop-in center, because we also had restrictions of how many drug users you can partake per day. We did that for the last for almost 4 months, and then after that we went back to the county commissioners through the Ministry of Health, the Director of Health Mombasa County. We got an approval later, and we started the new normal of still going out to the field, but with other restrictions like carrying water bucket for hand washing facilities. And currently we are going on well with the outreaches activities. Another main component for our organization is support for women who use drugs. I'm one of the pioneers of that program, and we started March this year during the International Women Day. We started the beauty corner at the drop-in center. So what we basically used to do, every Wednesday we call it Crash Wednesday, where we mobilize recovering drug users and those who are still actively using heroin to our drop-in center, and the safe space is basically free for only women to just run the activities for that Wednesday crash. We also had to stop that activity because of the Ministry of Health guidelines of no gathering of people. But then after COVID, we alternate that activity, and we were doing food packages where we used to buy dry food and distribute to the women who are in recovery, who are living with HIV, and who are also actively using methadone and actively using heroin. Then after the pandemic, we resume our sessions again. We have so far taken them through beauty therapies courses and also baking classes with some community members who offered those courses at a very reasonable price. So in general, I would say we started our new normal around July, and we've been going on with our activities as before COVID. One of the other activity was we normally feed 80 to 140 drug users. These are actively using heroin per day. We give them lunch Monday to Friday. This is one of the activities that was very, very much interrupted with COVID, but then with the new normal, because before COVID we used to just eat I'll say the Swahili way, like 2-3 people eating together. But then after COVID, we are now doing pre-packed food, where we just pre-pack the food, and once they come, they'll start dropping in here around 10:30 to around 1:30. So when they come, they're just given the their pre-packed meal, they pick and go. So one of the most essential activity we've not been able to continue to date is the group session. We call it psychosocial support group meetings that we used to run every day, Monday to Friday, for the recovering drug user and those who are actively using, because our drop-in centers, the way it's structured, we cannot take that risk of having a group of 12, and those are group meetings. So we had to stop that up to now, but we are seeing individual clients who have individual issues, either being addressed at the clinical level or at the psychosocial level. So in a nutshell, that is what we do.
This pandemic forced the institution to stop its services for a while as the government was working on ways to contain the pandemic. During this time, most of the patients the institution takes care of had to stay away due to lockdown restrictions, and this adversely affected their rehabilitation. After several months, the institution resumed operation, but in strict adherence to the Ministry of Health guidelines of social distance, face masking, and frequent washing of hands and sanitization.